Okay, everybody, welcome. My name is Garland Colson. I'm the marketing director of PresentationPoint. With me here is Kurt DuPont, the founder of PresentationPoint. And today we're going to be talking about healthcare digital signage ideas. And this session will be recorded, so you will be able to access it later on, or be able to share it to your colleagues who weren't able to be here. And I'm just going to start by sharing my screen. And I'll start a slideshow. Okay, and if everybody can let me know if you can see my screen. If you can let me know in the chat. Great, okay. So as I said, do feel free to ask questions in the chat throughout, and I'll be happy to answer them for you. And let's get started. So healthcare digital signage ideas. So what's healthcare digital signage, and why is it of importance to anybody? So digital signage is really just signs that are put up on screens and monitors, televisions, computer monitors, and the like. And the growth is explosive. You can see them everywhere. Huge screens in the sides of buildings, screens inside buildings, outside buildings, screens in government offices, screens in banks, screens in airports. Retail shopping centers, everywhere you go, you're seeing screens. And okay, and let's talk a bit about digital signage versus traditional signage. So I like traditional signage, the old cool signs, the metal ones that might be up in the wall and things like that, but they just don't share the same level of information that you can get with the digital signage. So to compare, digital signage lets you add movement and transitions with video and changing graphics. So it draws the eye to the screen, and you can have multiple messages on a single screen. You can have it, paging through slide after slide. So you can be showing multiple messages in that single screen. You can update multiple signs from a central source, and you can connect to live data such as weather and news, such as the example we're showing in the bottom here. Traditional signage is difficult to change. If it's a metal sign, or even if it's a paper sign, you got to print it, you got to mount it, and then in the moment something changes, you got to print a new one. And very expensive to change, especially if it's metal or neon or something like that. And you can only have a single message in that space. So let's talk about some of the ways that you can use digital signage in a health facility, in a health setting. And this would include hospitals, it would include clinics, it would include dentists' offices, it would include labs that are taking tests. So any of these, anything you can think of relating to health. Let's look at a number of ways that you can use it. And the first one is wayfinding. So you don't want people who are hurting or in a crisis or in an emergency to have any problem finding out where they're supposed to go. So you want to make sure that there are arrows pointing to where there's an emergency department. You want to be able to point people to where they find the X-ray lab to get their X-rays done, or where they go for a blood test, or where they're going to find the cafeteria. You want to make it as easy for your patients and your visitors as possible to be able to find this. Digital signage works fantastic for this because you can control exactly what's showing in each screen, which direction it's pointing, and it doesn't have to be used just for wayfinding. You can also put additional messages, between. You can have it rotate through, pointing the arrow to where it's going to go, but also adding another message as well. Now, secondly is emergency room intake. And this is a key one, because when people come into the emergency room, they're nervous, they're scared, they're hurting, they may be disoriented. So there's a lot of difficulties that the people are finding to be sitting in the emergency room. And you want to make sure that these people are taken care of the best way possible. One of the key things you can do first with digital signage is to have people tell you immediately if they have certain symptoms. There's certain symptoms such as, heart, like chest pains. You need to tell the nurse right away, the intake person right away when you're coming in, because that could be a sign of a heart attack, and that will put you to the front of the line, and to make sure that they're dealing with that right away. So this is key. You want them to tell you at once if they have any of those symptoms. Of course, we have COVID-19 going on right now. So if you want people to be told what to do if they have COVID-19 symptoms, should they be here at all? Should they be going home and getting a test first? But if they're having problems actually breathing, then they do need to be in the hospital. You can tell them on the sign where to wait and what will happen next. So people know what's going on. And people have a lot of fear when they're when they're hurting, and they want to know that they're going to be taken care of. You can also, on the emergency room intake, have instructions on what they should have ready. So they should have their identification ready, their health billing information, a list of any prescription drugs they're taking, any pre-existing conditions that the medical people need to know about. So all of this helps if you've got it on your emergency room wall. And again, digital signage works so much better for this than a printed sign, because if you've made a mistake in a printed sign, or you say, oh, we shouldn't be asking this as well, it takes 30 seconds to fix that on a digital sign, whereas ordering new signage to be printed might take weeks. So this is, again, where digital signage really shines, with being able to change right away. You can also have location-specific info. Now, this is kind of related to the wayfinding we talked about, but this means you can have signs at certain areas, such as where the exits are. And at the exits, you can also talk about, transit info or taxi or ride app info, so people know how they can get, back to their work or back home when they're leaving the facility. You can also have x-ray warnings, so if they're near the x-ray lab and they've got a pacemaker and they shouldn't be within, that distance, you can say, warning, please stay away if you have a pacemaker. So you can have all of these location-specific screens and data information showing, so that people are able to, get help for that particular area. And that includes wayfinding, how to get to the next point. Waiting rooms. Waiting rooms, you have a captive audience there. They've got nothing to do but wait until their turn is called. So now you've got lots you can do with them. You can inform them. You can point them to helpful resources. You can entertain them. And it helps make the wait seem shorter. It helps take people's mind off their pain and reduces their stress. You could even have a guided meditation going on the screen that people could follow. And remember, you can show different things on different screens so that it's going to appeal to different people. But now that you've got this, captive audience, people hurting, people in pain, work with them to help them make the wait seem shorter by providing them useful information. So children's entertainment, nothing is more heart-wrenching to me than seeing children in pain. It's a horrible thing. You just want to walk over there and take their pain on yourself if you could, but you can't. So it's important to have ways to keep children's mind off of the pain, to keep them entertained. Remember too that parents might be forced, if they don't have if they're a single parent, or their second parent is just not available at the moment, people may need to bring their children's siblings as well. So they might have to bring the whole family just for one child being sick. So having children's entertainment makes things go so much faster for them. So have convenient height screens, convenient seating for kids, where they can, get involved and make that time go faster for them while they're waiting. Upcoming events, clinics, things you're hosting. If you're doing a blood donation drive, you can say, you've got all these captive audience there. You can talk about the things that are coming up. Fundraising campaigns, getting people to donate to help your friends of the hospital, or any, nonprofits you're supporting. Any volunteer opportunities, of course, hiring opportunities as well can be done. So anything coming up, events, clinics, anything special going on within the hospital or the health facility, you can highlight there. Cafeteria or food information, you can create digital menu boards that show people what's on the menu. It's very easy to change, very easy when your soup of the day is changed. Probably your health facility menu won't be as nice as this one, because this one's got beer and wine and cocktails, and it might be a lot more fun going to the hospital or health facility if their local cafeteria did have those options. But this is just an example of a digital menu board I picked up that I had gone by in the airport that I took a picture of. And I was mentioning to Kurt when we were first here, I went into a hospital here in Canada, and they had these older cathode ray tube TVs set up with cable for entertainment in the rooms, which I thought was just insane. I just think they should just give us all decent Wi-Fi and let's watch our Netflix on our tablets. Would be much better. But you can replace these antiquated cable TV systems with modern smart TVs you can add ticker and emergency information that you can show right in these TVs. And there can also be information between the channels. So there can be a special hospital channel, health channels, and things like that. So in essence, you can create your own information channel, your own television station that's health-based, that you can be talking to your patients. And you can have the TV default that it's coming onto that channel. Rooms, if you have any rooms within your facility that are being allocated for certain meetings, things that are being done. For example, when I was diagnosed with diabetes, I had to go to a class on how to deal with diabetes, how to live with it. And so that class was in a hospital, and they had a sign up showing the, which room it was going to be in, so you could easily see. So classes, blood donation clinics, meetings, anything going on, if you've got rooms that may change what they're being used for, you can use digital signage for that as well. Emergency digital signage in the event that something's going wrong, earthquake, fire, hurricane, flood, whatever that might be. You can immediately have an emergency playlist that kicks in that tells people to keep calm, gives them evacuation instructions, tells the staff what to do. So this is a great way to make sure that in an emergency situation that you can communicate throughout the facility with both your staff and your patients. Queue management, and we know that one of our people was wanting to talk specifically about queue management, and we'll be happy to answer any in-depth questions about that, when I get through the presentation. But waiting is tough, and if you don't know how long it's going to be, it makes it very difficult. And I went recently to a lab where they were going to be doing my blood tests, and I could look up on the screen, and up on the screen it showed my first name and my last initial, and it showed where I was in the queue. So I just got in, you could see you're number 4 in the queue. You go, that's not too bad. And so you can see as people's names drop off the queue, you see yours going up. And that helps. It relieves stress because you know that you're being taken care of, and you know that they haven't forgotten you. I mean, how do you know if they have, because there's been times when I've been waiting for something in a queue and I've been forgotten. So this way it just shows that everybody's being helped. You can even put estimated times, how long you think it might take. Or it can be a take a number type of a queue, or you can show people's names on the screens. So there's many ways to do the queue management, but it really does help alleviate that stress when you're waiting, and especially in a health facility where you're hurting and something's wrong with you. So let's look at a few examples of how it's being, how digital signage is being used in some health facilities. So sorry about the bad resolution on this, but this is the Idaho Department of Health and Welfare. So of course the resolution on their screens would be full resolution. So what are they doing here? They're paging it through some different things. It doesn't page this fast. This is just because this is a GIF created from it. So what they're doing is they're helping people with things like, mental health. Okay, so where do you call for mental health? Where do you call for suicide prevention? Do you need help with a drug problem? Do you need better child care assistance? All of these different things are going through. Plus it's showing people what the weather's like outside. You can show a little bit of news on here if you want, but this is a great example of how to keep people informed. And it's also connecting people to the whole health system. So if you're there in that waiting room because you broke your arm, then that's, yes, you're getting help for that. But in addition, you're becoming aware of all of these other things that can help you with your family, with your children, with mental health, or if somebody else in your family is suffering from any of these, you suddenly have all these resources that you can easily connect to by phone or by or by a website or something like that. So this is a really good example of how this can be done. Mexican Red Cross is using our software, to inform their staff and their visitors in their facility of what's gone on, what disasters are currently happening, what's being done about them, any evacuations that are in place, donation drives that are going on, volunteer opportunities, employment opportunities. So you can use digital signage for any of these. This is just a care home, just a really kind of a neat example of how a care home can use it. So they use digital signage to show upcoming events, celebrate people's birthdays, show what's happening in a dance. They can use the same screen, of course, to show movies if they like, but it's a great way to keep people informed what's going on, create a sense of community, also connect people to health. If there were, again, you could be showing suicide prevention lines or different kinds of resources that are available within the facility if people are having problems or struggling with anything. So how do you do all this stuff? So we talked about all these great ideas. How do you create healthcare digital signage? And we really recommend PowerPoint for digital signage in healthcare facilities. Number one, it's really easy to use. You don't have to learn any clunky, proprietary, weird software, that somebody's developed to try to design graphics, because PowerPoint is already great for graphics. Microsoft has put tons of money into creating that, and nobody else is going to be able to create something at that level without putting that much money and time and effort into it. So go with PowerPoint. It's very easy to use. Most health organizations already have access. If you're a nonprofit organization, you can often get this software for free or very low cost, but most health organizations already have access to PowerPoint as part of the Microsoft Office bundle. And there are very powerful digital signage add-ins available that make it very easy to connect your PowerPoints to real-time information and to be able to show it on your screens. Some of the recommended digital signage tools that we offer include DataPoint. DataPoint lets you connect PowerPoint to real-time data sources, news, weather, patient information, queue management. There's a lot of different things that can be done that way. So we can control all of that within DataPoint. We have a tool called iPoint, which lets you manage playlists, including PowerPoints created with DataPoint, but you can manage video, audio, PowerPoints, and all of that kind of information. You can schedule it for the time of day. You can have an evening playlist. You can have a first thing in the morning playlist where telling everybody when's coffee coming. And we also have Signage Tube for managing those playlists where you're not connecting to real-time data. So I'm going to talk just briefly about a few design tips when you're thinking about designing for digital signage. And the first one is know your purpose. What's your why? Why are you doing this? Are you doing this to inform, to entertain, call to action? Do you want people to take, what is it you're doing that way? Limit the text. Bullet points after bullet points on a screen just get really boring. People can't handle it. So just limit the text. Use powerful graphic with a small amount of text. Leave room for the text as well. Let it breathe. Like you can see, there's lots of white space around the text. They haven't filled it up, and it's attractive, and it just shows off much better than trying to put a whole wall of text. And remember, you have multiple slides. You don't have to jam everything onto a single slide, because you can say this slide's going to be up for 10 seconds, and then the next slide will show, and then the next slide, and so on. So you can have literally an unlimited number of different messages you're showing on a screen. Keep in mind, you can also be annoying with that. When I go see some digital menus, I'm trying to read what I might want on the menu, then they flip to an ad. It annoys me because now I'm having to wait for that ad to go by to come back to the menu I was looking at to see what I want to order for my drink or what I want in my hamburger or what I might want to get. So you can be annoying flipping through the screens too fast. People have to be able to read. Use powerful photos, like something to connect people, something to tug at their heartstrings, and that will really draw attention to it. Something that's going to be really intriguing for people. You can draw them in with an interesting photo. Inspire, use emotion, show photos that inspire and use emotion, use words that use emotion, that are just going to attract people to all this content you're creating, and use movement as well. Yeah, you see all the news places do the news flashes and bring in the screen, because that immediately draws your eyes to it. Have you ever noticed how when you're sitting with someone in a coffee shop and your purpose is there to talk to each other, that if there's screens up and there's movement, you can't keep your eyes off the screen? Especially bad for those of you who go to coffee shops with men and there's a sporting event up on the TV. You'll notice that you're not getting a lot of attention at all from the man across from you who can see the screen. And it's funny, I'm not that into sports and I still find myself looking at a screen because the movement draws me even when I'm trying not to. So digital signage screens are hypnotic. They pull you in no matter what. Use bold colors. I love like a bold color change on a, when it's used, something like this will just draw the eye and bring people to it right away. I'm a real fan of bold colors. Now, the funny thing is I'm a bit of a minimalist. My office doesn't have a lot of extra stuff around it, but I like bold colors. So I don't like just everything to be, stark white or chrome. It's other health organizations using our software. I mentioned the Idaho Department of Health, Baxter, Bayer, Pfizer, Medtronic, Shire. So we've got a lot of different people using our software as well. And if you want more help with any of these, of course, you can find us at PresentationPoint.com. So let's open it up for questions and comments. Yes, we had Keith before was saying that they're looking at building a new health center, looking at queue management and signage. Did you have any questions about queue management, Keith, that we can answer? I mentioned how I'd seen the one in the lab. I really liked how that was done because it had my name up there, and it was showing right in the screen and was showing where I was in the queue. So that's really powerful, and that can be easily built using our DataPoint software. And Orhan, what kind of health messages were you thinking in your health center in the school you might want to direct people to? Vaccinations, clinics, like, what kinds of things? Are there events? You do blood drives at your school? And Orhan says we're running COVID videos across the school. That's intriguing. So are they videos? I imagine videos on prevention and I really think it's tough with schools because I remember when I was in school, when the bell went, you were wall to wall, like shoulder to shoulder out in the corridors with the students. So it's very hard to social distance in a school setting. I think it's very tough. That's a great point. You can include videos. Videos are something you can include, audio in your digital signage, and so certainly COVID videos would be a great one to do. Keith, looking at integrating an app that does booking appointments and integrating it with a check-in kiosk and a digital sign for queue management and wait times. Have you seen this implementation before? I know there's ways we can do this. Kurt, have you seen this particular one with that before, or we could talk about how we could do that?
Yeah, definitely. So what you often see is that people get a number from a ticket dispenser. So you have one number for a specific division, so to say, at the reception desk. And then you can show those numbers on the screen and you can calculate if you have averages on how many people are in the queue and averages, you can calculate the wait time and so on. That's using data and calculations.
Now, another method that could be done was you could have a check-in kiosk And basically it's going to update a little database. So somebody puts in their name, and then they would be added to your database. And then the screen DataPoint can take the information from the database, show just the first, last name and first initial on the screen rather than the whole name. So we're not, you don't want to give up everybody's name in that case. And it could then show the queue order that they're in. We could do that using DataPoint as well. So essentially, at its heart, most data is just simply a table. Think of it like an Excel spreadsheet. So once you can get the data into anything, we can get that out and on the screen using DataPoint. And what DataPoint does, for those of you who may not have used it before, is DataPoint lets you connect any text box or any image box or any object on a PowerPoint screen to real live data. So it will automatically show the next person in the queue. It will automatically pull up the waiting times. It will automatically pull up any data you have in a database. It will then pull up and show it on the screen. Orhan is asking, is there any plan to equip queue management with a central database? Right. Currently, multiple queues cannot be managed, but independent from each other only. So one aspect of this, so with PowerPoint and DataPoint, what we can do is you can create a PowerPoint slide that can include data sources from multiple databases, from multiple. So if you had, say, multiple queue managements for a reason, let's say, because you're doing two different kinds of labs and you also wanted them separate, but you could still show them on the same screen because one of the text boxes is going to pull from one database and then the other one's going to pull from another. And so this is used, for example, in manufacturing companies. We will pull information from different manufacturing machines, the data, and show on one single dashboard, which is, manufacturing companies love it because they've never been able to do that before. Similarly, I mean, if you wanted to, you could create one screen at a nurse's station that would show the vitals of 10 different patients on the ward. We could show that on screens or have it page through and show that, but it's all coming from a different monitor, a different database. So yes, there is a way to pull the information around that. So I think that, and certainly keep in mind as you're working with it, if you run into trouble, we're happy to help. I mean, Kurt's already been working with you on some of your implementations, but we are happy to help with this.
Maybe I can add, Garland, if you have multiple queues or multiple divisions in the hospital, or maybe if you just want to separate men and women, for example, you need to have two ticket dispensers. So people can take one from the left ticket dispenser and one from the right. And then you have already a queue specific for a specific group. And then you can just increment that number on the screen. And you can, as you said, Garland, display multiple numbers on the screen.
So Keith is saying Signage Tube does not support real-time data. Trying to get my head around this for my application. Yeah, so Keith, I know it's kind of confusing because we talk about multiple different softwares here. So essentially, iPoint and Signage Tube do much the same thing. They are for creating playlists for your digital signage. Now, iPoint has been around for a long time and was built to work with DataPoint. So of course, we've been able to enable that for DataPoint. At this time, Signage Tube does not support real-time data. It's something we hope to add in future. So Signage Tube is great for creating static digital signage, but if you're changing something on a screen, you will need to change the slide. That's really the difference there for the playlist. So if you do need real-time data, you should be looking at a combination of DataPoint and iPoint.
No, and the technology is completely different. I mean, DataPoint and iPoint is using PowerPoint as the presentation engine, while Signage Tube is basically where you use a smart TV, where you have an Android player on board on the smart TV, and then you still use PowerPoint and you still can use DataPoint to update your presentations. But basically with Signage Tube, you upload your presentation to the cloud. We convert the PowerPoint into a movie, and the movie is played back and sent to your television screens, to your smart TV. So you always have a little delay in the data update. So you don't want to use this for critical information that it needs to be updated every second. But if you need to have updates every 15 minutes or 5 minutes or whatsoever, then you can perfectly use still DataPoint and PowerPoint and upload it to the Signage Tube website.
Great. Any other questions? I should mention as well that our software has free trials, which means that you can, you can download it and play with it and see, make sure it's going to do what you need it to do. And our support, we always get back to people very quickly, to be able to, help you with anything that you're looking at doing. And if you look at our case studies area on our website, there's just tons of people using our software for a wide range of creative things. And we love it when our clients tell us what they're doing. And so any of you doing any of these implementations, please let us know, because I'd love to write an article about it and feature you on our blog, because the real life case studies are really popular with other people. And we can point to these and say, yeah, somebody else did do this. Here's how they did it. And it's great to see how much creativity our clients have. Any additional questions about anything relating to digital signage, healthcare or not? Do you have a what if dream you'd love, could it do this? And we can tell you whether it can do that. Just wait a minute or two, see if anybody's got any additional ones. Orhan says, one of the best investments we've ever done, and a pleasure to work with this company. Thank you so much. I'm glad to hear that. And we'd love to, I hadn't worked with you yet before, I guess you've been working with Kurt, but please, once you get it set up, please contact me, garland@presentationpoint.com. And I'd love to write an article, and maybe if you can send me a few pictures and answer some questions for me. We'd love to see how you're using it, because that would be fantastic to see how it's being used in the school and how you're using it for COVID in the school and things like that. Keith said, I'm recently looking for the PowerPoint viewer for something, and it appears Microsoft is getting away from providing a viewer in the future. Is that true?
Seems to be. They have withdrawn the support for the PowerPoint viewer. Probably what they want to do is to go to the full PowerPoint where you have all the functionality. I have to admit that when you start using plugins for PowerPoint, they were always working with the full PowerPoint, but not with the free viewer, because the free viewer is something that you install on a PC unlicensed for free, and you can't add functionality to that. So our plugins for automation and displaying real-time data was in the past not working with the PowerPoint viewer. So basically, you can even, if you lack the functionality of the PowerPoint viewer, you can also convert a PowerPoint presentation into an MP4 movie and then use it as a movie itself on the display. Because even with the viewer, you can't update or show real-time data.
Yeah, that's something I'm not sure how many of you have done. PowerPoint, you can easily create videos from PowerPoint too, which is really quite powerful if you need other ways to be able to show things. So.
No, I use it all the time for creating flyers, documents, reports, movies, and so on. It's much easier than using a Word or another application.
Yeah. Yeah, Keith says, thanks, Kurt. I've been doing the conversion to MP4 and it works great. Yeah, yeah, it's nice. It's just so easy to use. And we've been playing with the with our DataPoint. Enterprise does video merge, so we've been doing some fun things with that, where we can create videos that are custom for each person you send it to. So that's been quite fun too. So.
No. And I also can tell you that recently Microsoft has added a feature to PowerPoint where you can render and create GIFs. So animated GIFs was previously not included in the export list of PowerPoint, but now is. So if you have Office 2019 or Office 365, then you can export your PowerPoint as an animated GIF, and that's very nice.
That's really useful. I can see, because that's a nice way to be able to share it as a picture format, but still have the movement and the things that happen there.
And it's very small in size, file size, so that's the advantage.
So I wanted to ask everybody. So we're planning on doing usually a webinar every month, and I'll put the new ones in the schedule we've got planned. But what do you want to see in a webinar? What examples would you like to see? What would you want to see in future? What should we be doing more of for content, for webinars, for videos? So because we do this for you guys, so if we know what you want, we can provide it. We're going to be providing the effort and the time to develop these, but it helps a lot if we know what you're looking for. So if there's something that you want to see, tell us, let us know, either through the chat here, of course, or by feedback later on, or by our contact form on our website. But we really want to know what kinds of content you'd like to see, what kinds of webinars you'd like to see. Okay, it looks like we've run out of questions. Do you have anything you want to add, Kurt?
No, I'm all fine, I guess. If no further questions are coming in, then we are always available offline via mail or the website.
Great. Yeah. Well, everybody keep in touch. I wasn't sure how many people we'd have today. We had a good turnout. I wasn't sure because it was health related if we'd end up with a lot less people because it was for a specific industry. But if you'd like us to do a webinar for your industry, or like a certain field you're in, whether it's education or health or finance or something, let us know, because we can put those together as well. So, okay, thanks for coming out, everybody. Thanks for coming and helping answer the technical questions, Kurt. And we shall see you next time on our next webinar.
Okay,
Bye-bye.
see you. Bye-bye.